So as we move forward, I want to ask you to grab your cup of coffee, get really comfortable. You're going to hear from a mesothelioma warrior who's a champion, who's my inspiration. I start to cry when I introduce you, Mavis. She's a dear friend, and I love her husband, Ray. Mavis, could you make that international welcome happen now, please?
I will indeed. It's my privilege and pleasure on behalf of all the mesothelioma patients and carers around the world to welcome you to this ADAO 16th Annual International Asbestos Awareness and Prevention Conference with the Film Festival that was just wonderful yesterday. You will hear from more than 40 experts from 7 countries. Sadly, as COVID has isolated us and made travel so difficult, we have to have a virtual meetup, but that's not a bad thing, as more people are able to attend and share the knowledge of asbestos and mesothelioma, as Linda brings her passion and knowledge to the stage. My asbestos story started in 1960 when I married Ray and washed his clothes. He worked in the dockyard as a shipwright, and asbestos was all around being installed or taken out of ships. There were no showers in them days, so you just came straight home and bathed, where I would then put the washing into the washing machine. All that dust didn't mean anything to us. We didn't know the dangers of the white dust that Ray had in his hair or on his boots. We were to find out in 2009 the damage that showed itself as mesothelioma when they drained 7 litres of fluid from my lung. No wonder I couldn't breathe. They have banned Asbestos UK, but that isn't so. That isn't to say we have, but that isn't to say we are safe from its deadly hold on us. We have so many tons in old buildings. Our hospitals, schools, museums and colleges still have the deadly substance hidden in them. So we have surveys carried out so we can manage asbestos or remove it, and that costs thousands. Asbestos is not banned in the United States, which is surprising to many people, and yet they know the danger and are being sued for compensation. Haven't they got the message yet? Imported products from countries such as Russia and China may contain asbestos even today, and it is the only known cause of mesothelioma and is also linked to serious diseases including lung and ovarian cancer. You may not see an asbestos warning label on products in the US. There are a few reasons for this. Certain uses of asbestos do not require warning labels. Manufacturers are often not required to check whether talc is asbestos-free, which I find so hard to understand. I really thought the US ban would happen this year, but no, we still have to fight. Let our first voices be heard. Use our voices. I wish you luck and hope 2022 will be the year that compassion will reign. We need a safer world and we need asbestos banned. The government's knew asbestos was killing the workers, but they thought that paying out compensation wouldn't cost as much as money lost if they banned asbestos. How wrong they were. Asbestos had been banned in more than 60 countries, and yet asbestos exposure is the #1 cause of work-related deaths in the world. Approximately 90,000 people die from asbestos-related diseases globally each year. An estimated 125 million people worldwide remain at risk of occupational exposure to asbestos, and about 1.3 million US workers in construction and general industry are at risk of exposure today. When will we take charge and ban this material and make our world safer? My journey began in 2009 when I couldn't breathe as I went to vote in our local hall. That started 4 years of chemo, and then 2014-2016 Pembro immunotherapy. After 2 years of complete freedom, my mesothelioma started to grow again. I re-challenged the drug, and after a great start, the cancer got crafty and wiggled free again. To date, I have a very slow grower, so I'm on a watch and wait. which has been a help in these COVID lockdowns. Reaching my 61st wedding anniversary in June and 80th birthday, the 27th of August, has been a great achievement. And I thank the National Health for that. Running the Mavis Nye Foundation with my board has been time consuming, but we are financing a Meso UK nurse and a research project as well as joining Meso UK and HASAD to finance the buying of machines for the PIPAC trial for peritoneal at Basingstoke. I have one last message to the Meso warriors. Stay positive. I'm the longest living immunotherapy mesothelioma patient in the UK. We are beginning to survive, but we must ban asbestos throughout the world. Let's save the future's lungs. Thank you, and enjoy the rest of the day.